One of the coolest things that I thought was how they let us meet a patient right off the bat, obviously not for medical practice, but just to kind of get the feel of what that relationship feels like. So we had a patient that we just had to go see and get a history of.
The first thing I did was go into the hospital and interview a real patient in the hospital and ask them about their social history, their life and what they do and everything.
But once you get in there and start seeing the patients and talking to them and listening to things, it's just like, it's a breath of fresh air, being able to be like, okay, so, you know, all this work will hopefully pay off one day.
They have scheduled in their second semester a program called Immersion. And Immersion is where you get to choose a field, whether it's a specialty or just a general field of medicine, and shadow a doctor.
We're allowed to shadow them for a certain amount of hours a semester, and it's a semester-long project. And we go in and just with a doctor and, you know, get comfortable seeing patients.
Basically, you're getting out of the lecture hall. You're actually learning a lot still, because the doctors will teach you stuff that they don't even think to teach you in here, that's just real-world application stuff.
Throughout the year, we'll have, you know, other patient interactions, either with, you know, standardized patients that we have tests on, or even going back into the hospital and taking, you know, if we do a physical or another history.
It's not just the studying the books, but actually that I'm getting to see patients, and I feel like I'm applying these things, and it's very helpful.
It's just a great way of being able to see right in front of me like what I'm learning in class. So spinal disorders lecture was 1 week, and then I shadowed my general physician and saw the spinal disorders, the radiculopathies that we were talking about.
Because when you're reading, you're like, okay, really, this doesn't happen. And then to see it crop up when you're like actually seeing a patient, that's really exciting.
Basically, they're helping you remember why you came and why you wanted to be a doctor in the first place.